will discuss to you how to take temperature, especially axillary temperature. I will not discuss anymore the concept of how to get the temperature, guys, just because it is done already, it was being discussed already in the lecture. Okay? So please open your portfolio. First is we have to review the medical records. We have to review the medical records. That means that we have to open and we have to check the medical records or the chart of the client. Okay? We have to check what are those factors that influences vital signs. Okay. So for example, if the clients would have a fever, okay, and we have to check right away, the chart. What happened to the client? Maybe the client has pneumonia. Of course, there will be hyperthermia, or there is fever. Okay? Or, for example, if the client will have virus, okay, just like coronavirus. Okay, so there is a tendency that the client will have a high temperature. Okay, first we have to review the medical records, no? And number two, we have to introduce ourselves to the client. Hi, good morning. My name. So you have to be joyful, no? Hindi yung hi, good morning. No, you should not be like that. No, you have to be joyful. Hi, good morning, ma'am. My name is Nurse Melchi Labawan Pulido. I will be your nurse today between 6, from 6 a.m. to 2 p.m. So that means, ma'am, that I have to take your temperature at 7 o'clock and another one also at 11 o'clock. Okay? So that is how we are going to introduce ourselves to the client. Okay? And we have to explain what we are, about the procedure. We have to explain the procedure to the client. And we have to gather equipments. So our equipments are, we have the digital, okay, we have the digital thermometer. And we have also the cotton balls. So we have the wet cotton balls with 70% alcohol. And we have also the dry cotton balls. Okay? So we will use this one later on to disinfect and to clean the thermometer. Okay? So after that, we have gathered all the equipments. Okay? Then what we're going to do is we have to perform now the hand hygiene. Okay? So do not forget how to do the proper way of hand washing. Okay? So that is very, very important. Okay? So next is we have to provide privacy. So we have to close the window, we have to close the door, or we have to the curtains also. Okay? And what we're going to do next class is we have to place the client in an appropriate position. Now, I think there is no appropriate position. It depends upon the patient. For example, the client would have this sitting position. Maybe this one is a comfortable position for the client, or maybe lying down in supine position, okay, or in prone position. Okay, so for prone position, it's okay, or side-lying position for the rectal temperature, if you have to get the rectal temperature. Okay, now those are the assessment skills. Now let's go to the axillary temperature. How to get temperature through your axilla. Okay, number one is check your portfolio. Okay, for number one is we have to remove, the client's arm. So if the client is wearing gown, then we have to untie it, and then we have to remove, and please do not expose the chest. Okay, to prevent what? Embarrassment. Okay, so we have to remove client's arms, and shoulder from the sleeve of the gown. And be sure that we have to avoid exposing the chest. Okay? So number 2 is we have to be sure if the axilla is dry. No? So we have to be sure if the axilla is dry. So if it is dry, then it's okay. No? But if it's wet, guys, what we're going to do is we have to get a pad, okay, or a piece of cloth or a tissue paper, and we have to pat it dry. Okay, can you understand that? Okay, and then next, number three is we have to prepare our thermometer. How to prepare? We have to open it. Okay, we have to open it. Okay, this one. Then we have to get the wet cotton balls. Okay, what we're going to do is, we have to clean in a circular motion from the cleanest. Remember this, because later on, after we have to use this one, iba rin po ang technique. There is a different technique. Okay, so we have to, from the bulb, okay, up to the stem. Okay, so we have to clean this one and discard. Number 2, and how to prepare is we have to open this one. We have to on this one. And we can hear a beep. So it says here low. Okay? And after this one, what we are going to do is we have to place now the thermometer and be sure that this probe will be placed in the center of your axilla. Hindi ganito. Okay? So what we are going to do is we have to place it at the center of the axilla. Okay? And we will ask the client to fold her head. Okay, here. Okay, to the chest. Okay? So we have to fold the client's arms, across the chest. Okay? And then we have to leave the thermometer. We have to leave the thermometer until it beeps. Until it beeps. Okay? And so we will wait for that thermometer, okay, until it beeps. Okay, so it beeps now. So what we're going to do is I have to remove the thermometer from the axilla. Okay, I have to remove, and we have to read. We have to read it here. So there is a window here. Okay, we have to read it here. So it says here that the temperature of my client is 35.9. Okay, 35.9. Okay, and then after that, we have to clean now the thermometer. Remember now, we have a while back, we have to clean it from the cleanest, to the dirtiest. Now, because was being used by the client, so what will happen now, this one dirtiest, and this one is the cleanest. So that means that we have to clean it from here, in a circular motion, okay, and up to the bulb. Okay? And then, and what we're going to do next is, we have to rinse one. We can rinse, we can wash it, okay, with water, okay? And then we have to return it now to the storage. So we have to close this one off, and then we have to place it now to the proper storage. Okay? Proper storage. So what we're going to do next is we have to record down the reading and the indication sign. Reading. Okay. So we have the vital sign sheet. So we have there the table temperature. So we have to write it in the chart of the client, no? And we have to write there 35.9 axillary or axilla. Okay? And then the time. Okay? That's all for temperature. Okay? So please do not forget, no, to go back, no, after that, to go back to your client. Okay? And fix, tie her down, and then after that, because we have taught so many things, then do not forget to wash your hands. Okay? And then you have to document. Okay? Okay? So, bye everyone. If you have some questions, please just write it in your comments sections. Comment sections. Okay? Bye.